Hello everyone. Today I bring you a video about the acid-base imbalances. So let's get started. So pretty much there is an equilibrium that our bodies always are trying to achieve. In this particular lesson, we're going to basically be talking about the function of your lungs and your kidneys in trying to achieve this equilibrium between an alkaline state and an acidic state in the body. The first and foremost that I want you to write down or learn is that the lungs are responsible. I'm trying to see how I put it together in a simple form. The lungs are responsible for this exchange in oxygen and carbon dioxide. And we talked about it in our previous lessons of the respiratory system. And so the byproduct of our body, what we expel out that doesn't work, it's carbon dioxide. Well, carbon dioxide is very acidic. And so when there's problems with the lungs, like respiratory mechanisms that do not work, then you either have a retention of carbon dioxide, so you're not expelling this toxin out or this acidic molecule out, or you have a lack of retention of carbon dioxide. You're not retaining enough, so therefore your body becomes alkaline and not in a middle state. However, on the other side, our kidneys also control basically bicarb. Bicarb is very alkaline, in contrary to carbon dioxide that is very acidic. So whenever the kidneys do not work appropriately, or perhaps there is a condition that we are losing so much urine, then we also lose carbon dioxide. I'm sorry, bicarb. So these conditions could involve things such as maybe the kidneys are not working properly because they have something called kidney failure. We don't touch that in adult, but just in general terms. Or perhaps there is a metabolic issue in your body that creates ketones, and ketones are very acidic. Or perhaps we have this loss of bicarb through the kidneys because of diuretics or things in other natures. And as we discuss each imbalance, we're going to be talking about different causes. So again, I'm just repeating, carbon dioxide is very acidic and bicarb is very base. The first thing after you understand that is learning your normal ranges. So you cannot go anywhere without knowing in your memory, by heart, these numbers. Try to find a way that you can memorize them. Find a clever way. Perhaps this way, how I learned them, could help you. But any way you find that is helpful for you, it's good. So I learned that the pH is 7.35 to 7.45. Carbon dioxide is the same numbers without the 7, 35 to 45. Now, bicarb, when I was learning these numbers in nursing school, I basically memorized that the number of bicarb is along an age, is between an age that I was going or I was it was my age in that time because I was approximately somewhere around 24 to 25 years when I was going to nursing school. So I learned that basically the bicarb was 22 to 26 because it related to my age at that time. Now, find maybe something that is helpful to you. Maybe it's your birthday. Maybe it's someone's street address. It doesn't matter. Just learn. pH 7.35 to 7.45. Carbon dioxide 35 to 45. Same numbers without the 7. And then bicarb 22 to 26. You're going to need these numbers for the rest of your career. And then you have your oxygen number, the arterial number, which is we want it from 80 to 100. Now, let's talk about the abnormal conditions. So we have respiratory acidosis, we have respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. What does all this mean? Well, we're going to hear shortly go over each of them, and they will make a little bit more sense. So just hang on with me. I know it's draining and, you know, it's not very interesting. It's a little boring, but you're going to need this. All right. So some people use the Rome method. The book talks about the Rome method of how to figure out these metabolic and respiratory conditions or acid-base imbalances. Now, I know there's some YouTube videos out there. They talk about the TikTok, yeah, something like that, TikTok method. But honestly, I learned the Rome method. The book talks about the Rome method. So I'm going to show you the Rome method, but please, by no means, use the one that works for you and that your brain understands. So the Rome method says that respiratory is always opposite and metabolic conditions are always equal. What does this mean? Well, respiratory, your pH, if it's acidic, is going to go down because the less of the pH, the more acidic it is. And your carbon dioxide, because it's related to the lungs, carbon dioxide is going to go up. And vice versa. Alkalosis, pH goes up, carbon dioxide goes down. On your metabolic conditions, you're looking at bicarb, the kidneys. So your pH, when it's acidic, is a metabolic acidic condition, then your pH is going down, same direction as it's going to go your bicarb. Alkalosis conditions, your pH will go up and your bicarb will go up as well. So it's either opposite directions of the numbers or in the same directions, the numbers. So let's take a look at it so you can kind of understand a little bit before I get into each disease. So we have the numbers over here. We are going to go over the respiratory first. So you have pH going less than 7.35. You make a little arrow going down. Excuse me. Then you look at the carbon dioxide. Is it between 35 and 45? Well, no, it's going up. So you make a little arrow going up. Then you look at the bicarb. Is it going up or is it going down? Is it normal? Well, in this case, it's going up. So by looking at your arrows, you already know that this condition cannot be metabolic for the simple reason that my pH arrow and my bicarb arrow, it's not going in the same direction. They're going in the opposite direction. However, my pH and my carbon dioxide, they're going in the opposite direction. So that tells me right there that this is a respiratory condition, and based on the pH, we're gonna call it acidosis. Here's my mark that they're going on opposite directions. Acidosis, opposite, respiratory, and the bicarb will tell us, the bicarb and the pH will tell if it's compensating. Let me explain that to you. So whenever the body compensates, is trying to always help you out, achieve this balance, it's gonna do something. So we have this person that is retaining a lot of CO2. Therefore, my pH is going down. It's going very acidic. So your body is smart and says, well, who has something that is base to counteract this acidic state? Well, the kidneys. So what the kidneys do is that they hold on to the most base item, which is bicarb. So therefore, my bicarb is going to be up, and my pH is, not normal, but is trying to get there. So that's why we don't say it's fully compensated. But that it's being compensating, or is trying to compensate, because my bicarb is going up. It's trying to help the acidic state. So let's look at the other one. We have a pH of 7.32. It's still going down. So that makes it acidic. We have a CO2 that is within normal state. And then we have a bicarb that is low. So look at now, your arrows are pointing down in the same direction. So based on the pH that we know it's low, is acidic, it's acidosis. My carbon dioxide, it's normal, so I'm going to just hold on to that one. My bicarb is going in the equal same direction, so that gets me that it's a metabolic acidosis state. And then I'm going to look at the CO2 to see if it's compensating or not compensating. So let's review. If we are in a metabolic acidosis state, that means that my kidneys are not holding enough bicarb. It's not retaining that much bicarb, because we know that the bicarb is very base, alkaline. So the lungs come in to help. They say, wait a minute, please help me. The kidneys are saying, help me, help me, help me. So how can the lungs help? Because the lungs control the CO2, and the CO2 is very acidic. So we don't want any more CO2 being retained in the body, because that will continue to be an acidosis state, but it can either expel a lot, so therefore my CO2 will drop, or it can kind of stay right there and not really do anything. So the reason that we know if my lungs are compensating is by lowering the CO2. When this case is not being lowered. So therefore we know it's not being compensated. That's just an overall explanation. Now let's get into each imbalance so you can see it in a deeper level. Before I continue, or I tell you about all these imbalances, I want to tell you that the more you practice the numbers, the better you will be, okay? I know it seems very overwhelming at the beginning, almost like a different language, but rest assured that the more you practice, Of course, seeing this video will help, or I hope it helps. You will get better and better. So the first condition is respiratory acidosis. This happens when we retain, hold on to carbon dioxide. It usually occurs in hypoventilation states or conditions. You have a pH less than 735, that makes it acidosis, and you have your carbon dioxide elevated, so it's going in the opposite direction, higher than 45. Typical conditions here that we can see that will cause respiratory acidosis are your respiratory problems or diseases. For example, COPD, chronic obstructive pulmonary disease. You're gonna learn soon if you watch the other video about why this is. You're gonna have maybe pneumonia as one of the causes. You're gonna have maybe atelectasis. You're not exchanging that air and carbon dioxide correctly. Maybe you have a pulmonary edema or overdose with sedative like narcotics or things like that. So the patient is not breathing adequately. Some of the signs and symptoms that patients can experience when they have respiratory acidosis is shortness of breath, dyspnea, restlessness, anxiety, confusion, because you're not getting, you're basically, your body's having this toxin in this acidic state, lethargy, your blood pressure could drop, headache, seizures, coma, or even a dysrhythmia. The treatment, guys, is simple. They're not breathing adequately. They're not breathing enough to expel the CO2. So let's help them out either by increasing the ventilation or treat the cause that is causing them to not breathe enough. For example, if it's over sedation because of narcotics, then you need to give them Narcan to reverse the opiate state. If it's COPD, you're going to learn that with COPD patients, we encourage them to do pursed lip breathing. That helps them expel that CO2. Maybe they need to get the head of the bed elevated to help them expand the lungs. Maybe having them do their incident spirometer so they can expand the lungs, expand the alveoli, and not have atelectasis. In this case, also, your kidneys will be compensating, and they compensate by elevating and retaining bicarb. If they return bicarb, is very base, alkaline, then my acidic state is going to hopefully fix. Okay, here are some easy to read or just visuals of respiratory acidosis. The next condition is respiratory alkalosis. Your pH goes higher than 7.45. That makes it alkalosis. And then you have your CO2 going in the different direction, opposite direction, going down in less than 35. Typically, the body here is expelling, losing too much carbon dioxide. So it occurs in hyperventilation issues. So let's look at some of the hyperventilation issues. Well, anxiety. I normally make a slight joke that I relate this condition to most of us when we have been or are a student. Every time before a test, we are a little anxious and hyperventilate. Well, Don't hyperventilate too much because you can end up in respiratory alkalosis. So anxiety, fear, pain, fever, maybe improper handling of the ventilation, like when someone has mechanical ventilation, like intubation, or central nervous system injuries. Some of the signs and symptoms are dizziness, confusion, headaches, muscle spasms, paresthesia, dysrhythmias due to potassium, losing potassium, nausea, vomiting, diarrhea, stomach pain, dry mouth because you are extra breathing. These muscle spasms, we call them carpopedal spasms, and your hands just kind of turn inwards. A lot of people that have panic attacks and anxiety suffer from that. Here, the kidneys will compensate because this is a respiratory issue. And what they'll do to compensate is that they're going to increase the bicarb excretion. They're going to say, kidneys are going to say, wait a minute, hold on. I cannot hold any more bicarb. I'm going to start spelling it out. So the treatment to treat respiratory alkalosis is slow the breathing down because we know it's a hyperventilation. So if you're having a fear or you're having anxiety, then let's go ahead and breathe with me. Let's try to breathe slower. They also have the patients breathe in a paper bag because whenever they breathe in the paper bag or a bag, they are inhaling again the carbon dioxide, which is acidic. So it helps to basically reverse this alkalosis state. If it's pain, let's treat the pain. If it's fever, let's treat the fever. So basically treat the cause and treat it fast, because if not, then you're going to end up in scary waters, basically. Here is an easy to read photo. Now let's talk about metabolic problems or imbalances. The next one is metabolic acidosis. pH is less than 7.35. That makes it acidotic. And now we're dealing with the bicarb because it is a metabolic condition. So your bicarb is going to be equal. So it's going to be going down as well, going in the same direction. Some of the causes that could lead to metabolic acidosis are things that will increase the acid production. For example, metabolic processes like lactic acidosis or diabetic ketoacidosis. When we talk about diabetes, you're going to learn how these are produced. Maybe anaerobic metabolic conditions, extreme hunger, or whenever you are expelling or you lose a lot of bicarb, diarrhea, problems with your kidneys, renal insufficiency, or intestinal fistulas. In our intestines, we have a lot of bicarb in our stool. So that's why whenever we have diarrhea, we lose a lot of bicarb. The signs and symptoms are headaches, dizziness, confusion, lethargy, weakness. You're going to have dysrhythmias due to possibly potassium imbalances. And then you're going to have this hallmark symptom, which are called Kussmaul's breathing. And I'm going to talk to you about Kussmaul's breathing in just a minute. You can have nausea, vomiting, diarrhea, clammy skin. So since this is a metabolic problem, and it's usually, your kidneys are involved with the bicarb, who do you think compensates? The lungs compensate. the lungs. So if I'm in an acidic state, this is a metabolic problems with my kidneys with a bicarb, my lungs come to help. I'm here to help. How can the lungs expel basically something acidic and help the acidic state be less? By breathing faster. And if I breathe fast, I'm going to be expelling something very acidic, which is carbon dioxide. So Kussmaul's breathing is the compensation mechanism of the body to basically bring me back to a balanced state. And Kussmaul's are these deep, fast breaths that the patient takes. And if you've never seen it, I encourage you to maybe go to Google and look at a video of how the patients look like. So how do we treat it? Well, we treat it by basically depending on the cause. If it's metabolic process like DKA, because we have a diabetic patient, then we need to start giving them insulin and hydration and so on. So you can do it by increasing the breath as well. You can give bicarb because it is very base, and that way it'll reverse the acidic state. And if it's kidney failure or insufficiency, which we don't cover in adult, but we just give them dialysis. So depending on the cause, then we fix it. If it's diarrhea, then of course, we need to stop the diarrhea. Here's an easy to read for your references. Last but not least on the imbalances is metabolic alkalosis. So this means that my pH is going to be high. Same thing with my bicarb. It's going to go higher than 26. Different causes could be an increase of base. Well, we can't consume certain things that are bicarby or base, like bicarbonates. What are bicarbonates? Well, like whenever someone has a lot of reflux, like gastric reflux, and they consume Tums or Alka-Seltzer, those contain bicarb or bicarbonate, and a lot of ingestion of that or eating of that, then yes, it could throw you into a metabolic alkalosis state. Or whenever you lose a lot of acid. We do have a lot of acid in our stomach, in our gastric contents of the stomach. And so every time we're vomiting a lot, or they're aspirating the stomach through a NG tube, you're going to lose a lot of acid. So always think stomach, acid, intestines, bicarb. Another reason could be maybe diuretics, because it makes you pee a lot and then you lose some bicarb there. Some of the symptoms are muscle spasm, tetany, seizures, dizziness, irritability, disorientation, lethargy, coma, weakness, tachycardia, or depressed respiratory drive. Let's talk about the depressed respiratory drive. Who compensates? The lungs compensate. And by us slowing the breaths down, the breathing of how many breaths I'm taking, I am compensating by retaining carbon dioxide that is very acidic, so I could go back in balance. So depressing my respiratory drive, it's basically the compensation state. To treat it, treat the cause. If it's vomiting, let's stop the vomiting. If it's the gastric aspiration, then maybe we need to slow it down. Diuretics, maybe slow it or pause them. And if it's use of excessive bicarbonate, then stop it. Stop doing that. But another way of treating it is decreasing the breaths, basically because the lungs compensate. Okay, here's an easy to read. Here are some practice questions. I'm going to post these later on in class, but there's a YouTube video on tic-tac-toe method if you want to watch it. Here is a chart that is also going to be on your PowerPoints. And again, you know, the more you practice these questions, the better you will be, the better you will get at it. And don't worry, in class, if you are my student, you will get plenty of practice. There's also a lot of practice online that you're welcome to Google and search for. I hope this was helpful. Again, my references, all my information comes from the book, from our textbook, the Medical Surgical Nursing, and all my images come from either the textbook or Google. Hope this was helpful, and I will see you in the next video.